If you follow the news on top the Mohbad case, police come out talk say the person wey treat am na auxiliary nurse. And it is important make I use this opportunity to correct something and speak on behalf of the registered nurses.
Okay.
First of all, in Nigeria, it no gets anything like auxiliary nurse.
Okay.
Under the law
of
healthcare in Nigeria, there is nothing like auxiliary nurse. It's either you be nurse or you no be nurse.
Wow.
If you be nurse, meaning say you go for training and you get license by the Nursing and Midwifery Council of Nigeria, then give you license. If you no get license and you call yourself nurse, no, you no be nurse, you be quack. Now, how auxiliary nurse they come out? Auxiliary nurse come out because of doctors. Now, doctors spoil these parts of the healthcare. Some big doctors for their hospital go train young ladies and then give them certificates, call them auxiliary nurse.
For their hospital.
And after a while, this thing they continue. It can't look like saying a normal thing. It is absolutely wrong. If you go UK, you go the US, you get what they call nursing assistants. Those ones, they get training by a registered body. But for here, because some doctors no one pay the registered nurses, no one pay them their normal salary, they can't carry young people, train them, call them nurses, whereas they are not,
give them lesser pay,
give them lesser pay,
more
hours to work, whereas they are not supposed to handle human being life. And this abnormality don't continue, and I feel make I use this opportunity to talk whoever want vex, make it vex. Doctors cause this rubbish. Now them mess up to this point. So it's either you are a nurse or you no be nurse. And I think doctors need to apologize to nurses for abusing their profession.
So you are saying professionally, there's nothing like auxiliary
there is
nurse.
nothing like auxiliary nurse in Nigeria. So auxiliary nurse not supposed to even put anything inside your body.
Sure.
The reason I they talk this thing because it dey everywhere for this country. If I talk and finish now, I dey tell you my phone. People go call me. Why you talk that kind of thing? When we see true, make we dey talk true. Tomorrow night, if it be somebody else, Mohbad case happen. Okay, you give Mohbad injection, self-trials on injection. You give him paracetamol, which are normal stuff. Maybe he can't develop anaphylactic reaction, and you don't even know what to do because you don't know anything about anaphylactic reaction. You don't even know some people say they react to paracetamol. I get one patient before. He no fit take any medicine for pain, any
problem.
He no fit take any. But because of the kind of country where we dey, our lawlessness, our anyhowness by the senior doctors, if I see them for face now, I no go fit talk, I go shut up. But because I get this opportunity, make I talk. So tomorrow if you see me, if you look me, I look
you. So is it that they know?
They know what will they tell me.
So the system they favor them. That's why they lock up systems.
Everybody they know this thing they pain me because they mess up the healthcare system. Every day, doctors they come out, nurses they come out. We they leave our people for people we're not supposed to handle human being.
How I want to know as the average Nigerian, because all this one are plenty.
You don't go no.
Let me wonder what's the difference between auxiliary nurse and the real original nurse? What's the difference between Akoshe and the written?
It dey funny. Make I make you understand and clearly. Just be like somebody just wake up and talk say I be auxiliary soldier. Oh, how you take be soldier? If we get one soldier man for our streets, and the man train us.
They let me
they wear you in uniform. So because of that now, I don't be waiting. I don't be soldier.
And they tell you they get one thing when they say they happen for South Africa. You don't talk about them a lot, doctor. A certain young man when they say, I know him for TikTok as Dr. Matthew, the 24-year-old. Yes, he actually not be doctor. If you know the boy for TikTok, like young, like 24-year-old.
Now the matter be that, then tell me last week.
TV stations, radio stations for South Africa, across Southern Africa, don't they carry this boy? They use and say they do as a source, as a everything. The thing when got boss now, one of the things, you know, some of these doctors when they do online content, you know them now. You know what they want to say. Not be everybody when put doctor.
For be doctor.
The naming they use officially, he tip from 1 year to intern. When they say University of Wits not even know one. Now only 10 schools they give doctor degree for their South Africa. So they can't track them because the guy when they talk, and you know when you say you they look what the person they talk and you they listen to your doctor and you they listen to your body, the thing not they align. Doctor, I may remind people again. I can say what's the difference between the fake and the real? Because this is we are all swept away. TV stations, radio stations, and media houses.
Okay, now permit me to say this. I want to make an appeal to the Nigerian Medical Association.
Please.
Yeah.
I know that they listen to us. It is high time you open a body. Make every medical doctor radio on social media. Make we get registered with you.
Yeah.
I don't mind maybe the Lagos State president. If we start from there.
Yes.
I don't know how to take Richie Oga. People know him. I beg. We need that. At least on social media, we need to regulate small. Because a lot of people, they online, they don't be doctor. Somebody for our company, then chop him. Then chop him.
So not be matter of education, no?
The person, if they listen to this program, then chop over 600K.
It's a lie.
And person will chop no be doctor. He meets me. So he follow me talk. Hey, voila.
So the way, so now that they say, as I get auxiliary nurses, as I get auxiliary pastors, where they shop people money. When not be the real ones?
No shade pastor, na doctor with the shade.
No. They're everywhere. Auxiliary, this auxiliary, they're everywhere. And they chop people money. They chop money anyhow, and they're not the real ones. So
the real doctors, most times, no, they even announce themselves outside. Say they be doctors.
Yeah.
And they lie you. They like keep themselves private and quiet because they know say the patient when they manage it, they do plenty. So the real doctors, in one way, no, they like to they come out, they show themselves, say I be doctor. They like the quiet, coded. The ones most I know they show stuff to anybody. No, they like show themselves. Then they like show. Yeah, I'm a doctor. Just they quiet and private, unless the matter come meet you. But you go notice say some of the people who no be doctor most time one day two put. The real doctor go tell you say, Oga, I don't know you. I not be your doctor. Go see your doctor. He go dey careful to prescribe medicine for you. He understand the consequences of that prescription where they give you. Because if anything happen, he knows say things they at stake. The other ones will just see you go and buy, go and take, go and drink. I see one on top TikTok again.
Yes.
Somebody ask him question because I did online. I did learn too.
Yes, no.
Person can ask him question. Can say go and buy this medicine. Go and buy this medicine. Go and buy. And I'm like, okay, because you get a large follower past me. How I want to tell you? Say this the way they do. There. What if this person go drink and he can't react to this person?
And I feel like take a shot.
Even if na the right medicine and he can't react, what do you go do for this person?
Okay, see, if somebody nicely ask, a medical person, sorry sir, are you a doctor?
Yeah.
What the person is supposed to expect from the doctor?
Because
you first call and say you first say somebody ask you tell them you graduate the school, you call what kind number? What
So some years ago, you know today common, and I did impressed. I want to see one patient. You can't say, go see me home. I say, what happened? He say, are you a doctor? Why? Because I look young. Yeah, especially doctor look old. Do you understand? Because
with glasses.
Yes. If you need to get white baby or you get bad head, all those kind of things.
Yes, not true.
Now I say, yes, I am a doctor. My name is Dr. Frederick Unugbohai. I finished from Ambrose Ali University. I graduated in 2016. I was trained in the ERA Specialist Teaching Hospital. My folio number is 80724, all those kind of things. I tell them. I can't tell them, say, if you still feel I shouldn't take care of you, I shouldn't attend to you, it is within your rights. I no go vex. Now so I sit down. The patient can't look me, can say, okay. Then I attend to them. So if you see doctor and you say, my mind no want me you teach me, it's you there your rights to say no, okay, I no want me you treat me. I know my body, me and you, our spirits no gel. Do you understand? So we need to ask because see some things. Okay, this other one I don't go talk about already. I beg because it is very heavy and we they do nonsense for this country. Nonsense.
What did we follow number?
Now doctors get them. It is special to
every
doctors.
Doctor get them.
Every doctor get a folio. It's called folio number, FOLIO number, to some other stuff. You understand? Okay. So when you become a fully registered doctor, you have your folio number.
That folio number now, how many digits, so that make people know now? Because when you ask, so that if you ask them, many people not just call is the date of birth, give you a question at the folio number.
I think what we go do with this regard, because this is not a very big area. We go try reach the NMA, Nigerian Medical Association.
Yeah, we need to.
And we go try reach them. I did one of the WhatsApp group. I go try reach to the. See there be big guys.
Yes.
So we go try. So that me them see come man, because this is not serious matter.
Sure. Yes. I know say for a couple of years ago they get one app they try do in partnership. I talk about our enemy. They talk they call them dodgy doctors. But after a while, I know when they see the website they pop. Normally they put the registry for most of the registered doctors, whether not for optometry, whether not for cardiology, no matter the branch of the medicine. When we say you study, you can go check whether this person true.
Yeah.
You don't register, whether it's still up to date, or whether it don't die. Because some people they use doctor name when don't die. Say they claim who they not be. Hello. Good morning. You get question for doctor?
Hello.
Mrs. Sua.
Yes, baby.
They give me new title.
I want to talk to the doctor.
He there
here for you.
Okay, doctor.
I did hear you, ma.
I believe well what you said, but some nurses who goes to school of nurses, as soon as they come out in time, as soon as they come out, they don't know even to give you injection in a normal place, even to deliver baby. Like a woman who they in labor, they don't know how to take the vital science of the woman.
Okay, thank you.
Thank you very much, man.
Thank you. Make I respond quickly to that. Now there is this misconception and this wrong talk. Say because the auxiliary nurses them do practical, so they know the job part. So let me say this clearly. Even before the nurses graduate come out, they do their nursing posting.
Yes, now.
Posting.
You need better sabi that thing.
They call them posting. They go move around different departments and they go train them. You understand? So no talk say because nurses they know not a lie.
They can't even specialize.
They do them, and as they practice, they increase in their knowledge. So no feel say the auxiliary nurses no work past the registered nurses. Absolute wrong thing be that.
Okay.
The nurses know their job and then get their limitations.
All right. Okay.
Hello,
good morning. Hello,
good morning.
Yeah.
Good morning, ma'am.
Doctor, I agree to.
Greetings.
I greet you.
What about the villages where they don't know anything about this thing? Where we they talk? What thing that born do now? So that those our villages they go know.
Village get the internet now. They're not getting
nice
internet.
Question, no.
Very nice question, no.
I did tell you.
Very nice question, because the TV they go on for that area, even strong past this one we happen for here.
Yeah.
The villages are now it gets what they call the TBAs, traditional birth attendants, and skilled birth attendants, where they train, because for those areas we don't get enough health professionals there. Those ones then train them and they permit them. Those ones even know their limits.
Okay.
But for where we did now, voila day. That medical brain drain.
Yeah.
When he go hit us,
You don't eat already now. Now they call the retired doctors come back and they give their part-time job.
Chook out. Wazobia 95.1 Wazobia.